is universal, but chronic pain is a daily battle for some people. I have Ehlers-Danlos syndrome, which causes severe pain, so I am a chronic pain patient. Part of why I wanted to talk to you guys today is that I have not tried medical cannabis in the UK, so I kind of just wanted to talk to you guys about your experience with Curaleaf and stuff.
When I started posting about it, there were some people that followed me that were completely unaware that it was even legal, like medicinally. I think sometimes if you're talking about your pain with a healthcare professional, that's not even considered an option, let alone even other like pain relief options, but also medical cannabis is not even in the conversation.
Before Curaleaf, I was pretty much just housebound. I've been in pain for as long as I can remember. Medical cannabis has been life-changing for me personally. Now I feel like me again.
There isn't really a day that I'm not in pain. A time when my doctor didn't take my pain seriously was when I was trying to get diagnosed with lupus in the first place. They sort of said it was depression and all in my head and that it wasn't a physical problem, which was devastating because I had all this pain in my body and yet I was being told it wasn't real. I sort of got to a point where I was like, okay, well, this is my life and sort of that's it, and tried to manage it best I could. I had to doubt my own body. I didn't know if the pain I was experiencing was real because of what they said. I was pleasantly surprised that you don't smoke it. Smoking is really bad for my condition. And so the idea that there were options like cannabis oil, tinctures, it felt better for me and my body.
70% of people living with chronic pain conditions in the UK are women, but 61% of Curaleaf Clinic's patients are men. Because of this, we think there is a link between medical cannabis and the gender pain gap, which is why we wanted to have an uncensored and honest conversation today. When so many more women and people with a female hormonal profile have chronic pain conditions, I obviously just thought that doctors knew everything and, about my body, which, the only expert on your body is you.
For me personally, it has been arguments and gaslighting and trying to really believe in myself because no one in the medical field would believe in me. Who are they to say what we are going through? I have Ehlers-Danlos syndrome. It's a connective tissue disorder, which means that my collagen is faulty, so every single connective tissue in my body is affected. After being on probably around 200 plus medications since I was 8 years old, I got to the point where I was on the highest dose of dihydrocodeine that you could be on, and it wasn't helping. I was on morphine patches, and all they were doing was scarring my skin. I'd done pain management courses at the hospital for weeks on end, and no one was wanting to offer me anything else because they were like, well, we've given you every pill that we can. People think that your symptoms are made up, even if they see it on an X-ray.
The gender pain gap has affected every part of my life and my illness. Any pain and illness I've had has always been dismissed. Even ones that don't feel related to my uterus or my gender, it's always been excused as hormonal or with my periods or I'll grow out of it. I don't know if that would happen if that were my brother, for example.
The video that I made to signal people to come and watch this right now, I had to bleep it out like I'm saying
A bad word.
a curse word,
Instagram will shut down my posts. It will shut down my account.
The censorship is there in some places to protect people online, but at the same time, we're also talking about something that also can really help a lot of people.
There's just so much stigma when we're talking about medical cannabis.
Yep.
Things like what we're doing right now can contribute to reducing that stigma. It's really interesting, isn't it? So many of the things that we talked about today disproportionately affect women. But because they're so often misdiagnosed or mistreated, it's ultimately leading to delays in finding the right treatment. To raise awareness of alternative therapies like medical cannabis, we need to empower women and non-binary people to initiate conversations and ask questions. Never feel like you don't deserve an answer, because you do. Censorship can make it more difficult for people to find the treatments that work for them and advocate for themselves. So tag your friends, tell a mate. It all helps so much.